Gentlemen over 60, there's a pill sitting in millions of medicine cabinets right now that's silently dismantling your ability to perform in the bedroom. It's not a street drug. It's not an obscure prescription. It's likely something you or someone you know takes believing it's entirely safe. That ends today. I'm Dr. Catherine Rotker, a geriatrician and men's health specialist with over 25 years of experience helping men like you reclaim their vitality. I've worked with hundreds of patients who came to me frustrated, wondering why their erections were no longer what they used to be. The answer, in many cases, was hiding in plain sight: medications. This isn't about isolated cases. Right now, countless men are unknowingly taking medications prescribed and non-prescribed for common, everyday conditions. Medications they trust, yet these same pills are actively sabotaging their erections, stealing confidence and intimacy piece by piece. The betrayal is real. Drugs meant to help are quietly crippling a fundamental part of your manhood. They disrupt essential signals your body needs, leaving you frustrated and confused. And the most dangerous part, too many doctors never mention this devastating side effect. Before we expose these common culprits, I need you with me. If protecting your sexual vitality matters, hit subscribe and tap that notification bell. Vital secrets for senior men land here weekly. Tell me this matters. Type PROTECT below if you want the truth about these erection-killing medications and how to fight back. Your health journey starts right here. Now, let's dive in. Drug 1. Acid-blocking medications. Many men over 60 are no strangers to chronic heartburn or peptic ulcers. If you've struggled with these conditions, chances are you've been prescribed one of the many acid-blocking medications available. Think Tagamet, Zantac, Pepcid, and many other acid-blocking drugs. These drugs are often viewed as harmless solutions to stomach issues. However, what you might not realize is that these seemingly simple medications could be causing more harm than good, especially when it comes to your sexual health. You might not feel any immediate side effects, but these drugs have a hidden impact that could be eroding your ability to maintain an erection over time. For men, especially those past the age of 60, the connection between acid-blocking medications and erectile dysfunction, ED, is becoming clearer and more concerning. The culprit lies in the way these drugs interfere with important bodily processes that regulate your hormone levels and blood flow. These medications work by targeting a system in your body called histamine receptors, specifically the H2 receptors, which are responsible for controlling stomach acid. By blocking histamine, they reduce acid production, which alleviates symptoms of heartburn and ulcers. However, this blockage extends beyond your stomach and can affect other areas of your body, particularly your sexual health. One of the most concerning effects is how these medications can disrupt the balance of testosterone, the hormone responsible for libido and erectile. For instance, cimetidine, the active ingredient in Tagamet, one of the most commonly used acid blockers, inhibits an enzyme that's necessary for the production of testosterone. This leads to a temporary decrease in testosterone levels, which can directly affect your libido and erectile function. These medications also have an indirect impact on blood flow. Histamine is important not only in the stomach, but also in the relaxation of smooth muscles throughout your body, including those in the penis. By blocking histamine, these medications reduce the blood flow needed for an erection, making it harder for you to maintain one when it matters most. A study on 22 men using cimetidine found that 60% of them developed gynecomastia, enlarged breasts, and erectile dysfunction, which resolved when the medication was stopped. This wasn't a coincidence. These side effects were directly tied to the drug's interference with testosterone levels. Extended use, especially beyond 6 months, correlates with higher rates of sexual dysfunction. While short-term use may have less impact, the cumulative effect of long-term use can cause serious damage. In fact, Some men experience erectile difficulties even after they've stopped using the drug due to the lasting effects on testosterone production and blood flow. I once treated one 66-year-old man, a chronic heartburn sufferer, who had been using Tagamet daily for 2 years. Over time, he began noticing issues in the bedroom, but he dismissed it as just getting older. When tested, his testosterone levels were alarmingly low, far below the normal range. I also noted a concerning score on the International Index of Erectile Function, IEF, which indicated moderate erectile dysfunction. After switching him to a different acid blocker, the results were almost immediate. Within 6 weeks, his testosterone levels returned to normal, and his erectile function improved significantly. By the time I reviewed him, his ED had nearly reversed. If you've been on acid-blocking medications for a while, it's important to understand the risks. What may seem like a small, harmless fix for heartburn could be affecting your sexual health in ways you didn't realize. Stay informed, stay proactive, and if you suspect that medication is behind your ED, don't hesitate to talk to your healthcare provider about options. Drug 2. Blood pressure medications. If you're managing high blood pressure with medication, you're doing the right thing for your heart and overall health. But what you may not know is that some of these medications come with hidden consequences that can affect your sex life. Among the most commonly prescribed blood pressure medications are beta blockers like Inderal, Lopressor, and Tenormin. While these drugs work to reduce your blood pressure and lower your risk of heart disease, they also carry an often overlooked side effect: erectile dysfunction. Beta blockers are designed to block certain receptors in your body that help regulate your heart rate and blood pressure. By doing so, they reduce the fight or flight response, calming your system and making it easier for your heart to function under pressure. But here's the catch. In the process, beta blockers also affect the sympathetic nervous system, which plays a critical role in the process of achieving and maintaining an erection. For an erection to happen, your brain signals the smooth muscles in your penis to relax, allowing blood to flow in and create an erection. Beta blockers interfere with this relaxation process, reducing the blood flow needed for an erection. Additionally, beta blockers may lower the levels of nitric oxide in your body, a compound that helps blood vessels dilate, including the ones in your penis. Without proper nitric oxide levels, getting or maintaining an erection becomes much harder. A comprehensive meta-analysis involving over 260,000 participants found that people using beta blockers had a slightly higher risk of developing ED compared to those who weren't on these medications. The risk was even more pronounced with certain types of beta blockers, especially non-vasodilating, lipophilic ones like propranolol. The good news is that not all blood pressure medications carry this risk. Drugs like ACE inhibitors, ERBs, and calcium channel blockers don't have the same impact on erectile function and may even improve it. This highlights the importance of discussing your medications with your doctor. If you're experiencing erectile issues, it might be worth considering whether your blood pressure medication is contributing to the problem, and if there's an alternative that could work better for you without the unwanted side effects. A case of one of my patients, a 68-year-old man who was diagnosed with hypertension and started taking Tenormin, a common beta blocker. Shortly after starting the medication, he began struggling with achieving and maintaining erections. It wasn't just a minor inconvenience, it became a significant issue for him, impacting his confidence and relationships. When we tested him using the International Index of Erectile Function, IEF, his score came back at 13 out of 25, which clearly indicated erectile dysfunction. Even more telling was the nocturnal penile tumescence testing, a specialized test that monitors erections during sleep. The results confirmed that the ED was likely caused by the beta blocker, atenolol. For him, it wasn't just about managing his blood pressure, it was about his quality of life, which was being affected in ways he hadn't expected. After discussing the situation with his cardiologist, we made the decision to switch him to nebivolol, a different beta blocker with properties that are less likely to cause ED. Nebivolol has a unique ability to enhance nitric oxide levels in the body, which helps to relax blood vessels and improve blood flow, essential for erectile function. Within 3 months of switching medications, his IEF score improved significantly to 22 out of 25, and he reported full restoration of his erectile function. The improvement wasn't just physical, it gave him back a sense of confidence and restored a critical part of his intimacy. This case clearly shows how important it is to choose the right medication, as the side effects of beta blockers like tenormin can be reversed with a simple adjustment in treatment. Drug 3. Allergy and sleep medications. For many seniors, first-generation antihistamines like Benadryl, chlortrimton, and Unisom become regular staples in their medicine cabinet. Whether it's to tackle seasonal allergies or help you sleep, these medications are widely used and easily accessible. Their commonality can lull us into thinking they're entirely safe, but this over-the-counter convenience masks a serious risk that you might not be aware of: how they impact your erections. Antihistamines like Benadryl have anticholinergic properties, meaning they block acetylcholine, a neurotransmitter essential for nerve signaling. In simple terms, they mess with the signals your body sends to your nerves, and this can disrupt functions that are crucial for an erection. These drugs can cross into your brain, affecting your parasympathetic nervous system. This system is responsible for triggering the relaxation of smooth muscle in your body, including in the penis, which is necessary for blood flow and erection. When these medications block that process, it becomes harder to achieve the firmness you need. If you do manage to get an erection, it might not be as firm as you want, making intimacy frustrating and unsatisfying. These drugs also block histamine, a neurotransmitter that plays a key role in sexual arousal. Histamine helps you feel that physical and emotional connection during intimate moments. When it's blocked, your body's natural response to arousal is dampened, making it even more difficult to achieve and maintain an erection. Many men take these drugs regularly for years, believing they're harmless. But as time goes on, the risk increases, especially when it comes to erectile function. Prolonged use of antihistamines can quietly build up in your system, gradually wearing down your body's ability to respond to sexual arousal. What's even more concerning is that these medications don't only affect your sexual health. Continuous exposure to anticholinergic drugs has been linked to cognitive decline in older adults. The same medications that might be interfering with your erections could also be impairing your memory, focus, and overall mental sharpness. Even prescription medications, like promethazine, often used for nausea and sleep, carry the same anticholinergic risks. Just because a medication requires a prescription doesn't mean it's free from side effects that can impact your erectile function. Whether it's OTC or prescription, the impact on your body can be strikingly similar. You're still at risk of experiencing ED, especially if these drugs are used regularly over time. 25% of erectile dysfunction cases in older men are linked to medication side effects. Antihistamines are among the most common culprits. These drugs, which so many seniors rely on for something as simple as allergy relief or better sleep, are silently undermining your sexual health. Nearly 50% of men over 60 report using these drugs regularly for allergies or insomnia. And here's the kicker: many of them don't realize that their medication use is playing a huge role in their sexual difficulties. Let me introduce you to one of my patients, a 68-year-old man who came to me after noticing increasing difficulty with his erections. He had been using Unisom every night for sleep and Benadryl daily for seasonal allergies. At first, he didn't think much of it, but after about 3 months of daily use, he began experiencing progressively worse erectile difficulties, which he initially chalked up to the natural aging process. When I reviewed his medication regimen, I immediately recognized the issue a perfect storm of anticholinergic drugs. These medications, when combined and used regularly, were the likely cause of his erectile dysfunction. After he discontinued the medications under my supervision, his erectile function started to improve. If you've been using these medications regularly and you're experiencing issues in the bedroom, don't just accept it as part of growing older. Talk to your doctor. The path to recovery could be as simple as finding a healthier alternative. Drug 4. Anxiety and depression medications. For many seniors, medications for anxiety and depression are a lifeline, helping them manage the daily struggles of life and maintain emotional balance. SSRIs, selective serotonin reuptake inhibitors, are the go-to treatment for these conditions. Medications like Prozac, Zoloft, Paxil, and Celexa have been widely prescribed to manage everything from panic disorders to depression and anxiety. While these drugs can be incredibly effective for mental health, they can also diminish libido and sexual performance, especially for men over 60. The real cost of SSRIs often remains hidden until it's too late. Many seniors on these medications are unaware of how they impact sexual function. The idea that a medication prescribed for mental health could affect your erections might not even cross your mind. For men over 60, the risk is even higher. Sexual function naturally declines with age, and the added impact of SSRIs can make this decline even more pronounced. Your once healthy libido may gradually fade, or your ability to perform sexually may diminish, leaving you frustrated and confused. So, how do SSRIs affect your ability to get and maintain an erection? The answer lies in the delicate balance of chemicals in your brain and body. While SSRIs boost serotonin to stabilize your mood, they inadvertently suppress dopamine, a neurotransmitter crucial for sexual desire and arousal. Dopamine is the chemical responsible for your desire to engage in sexual activity, but SSRIs block its production. This leads to a paradox. Your mood improves, but your drive doesn't. Furthermore, SSRIs can also suppress testosterone production, another key player in sexual health. Testosterone levels naturally decline with age, but SSRIs can accelerate this process, making erectile function even more difficult to maintain. The combination of suppressed dopamine and testosterone leaves you struggling with not just your mood, but your ability to perform in the bedroom. One of the most insidious effects of SSRIs is how they affect the maintenance of penile tissue. As these medications suppress testosterone, they hinder the natural repair and upkeep of the blood vessels and tissue in the penis. This can result in long-term, progressive ED, often before you even realize that your medication is the root cause. Research shows that sexual dysfunction is a serious, yet often overlooked, side effect of SSRIs. In fact, studies indicate that between 30% to 70% of men using SSRIs report experiencing some form of sexual dysfunction. This can range from a decrease in libido to full-blown erectile dysfunction, ED. Among SSRIs, one medication stands out in its ability to significantly impact sexual function, paroxetine, commonly known as Paxil. Paxil has the highest risk of causing sexual dysfunction compared to other SSRIs. Another disturbing fact, post-SSRI sexual dysfunction, PSSD. This condition occurs when the sexual dysfunction caused by SSRIs persists even after you stop taking the medication. Roughly 0.46% of men, around 1 in 216, experience PSSD, meaning they continue to struggle with ED for months, or sometimes even longer after discontinuing the medication. One of the reasons SSRIs have such a profound effect on erectile function is their impact on nitric oxide production. Nitric oxide is crucial for initiating and maintaining erections. When you become aroused, nitric oxide is released to help the blood vessels in your penis relax and dilate, allowing more blood flow. But SSRIs interfere with this process, reducing nitric oxide synthase activity. As a result, your ability to achieve and sustain an erection is compromised. In addition, SSRIs alter your autonomic nervous system, the part of your body responsible for controlling involuntary functions like heart rate and blood pressure. When SSRIs disrupt this balance, they create an anti-erectile environment in your body, further hindering your ability to get and maintain an erection. Let's consider the case of a 72-year-old man who had been using Zoloft for generalized anxiety disorder. Like many seniors, he had struggled with anxiety for years, and his doctor prescribed Zoloft to help manage his symptoms. However, over time, he began to notice something troubling. He was losing his morning erections, and his erections during intercourse weren't as firm as they used to be. At first, he assumed this was just part of the natural aging process. But the changes kept happening, and the frustration began to set in. Under my supervision, the man gradually tapered off Zoloft, and I switched him to a different medication, bupropion, which has fewer sexual side effects. Over the next 6 months, his erectile function improved significantly. While it may seem like a daunting problem, ED caused by SSRIs is not always permanent. In many cases, adjusting your medication or switching to an alternative treatment can bring about significant improvements in erectile function. So, if you're struggling with ED and suspect that your antidepressant might be the cause, talk to your doctor. There's help available. And with the right support, you can get back to enjoying a healthy sex life. We've covered a lot today, but the key message is clear. The medications you're taking could be quietly affecting your sexual health, especially when it comes to erectile function. Understanding the risks of these medications is the first step. Sexual dysfunction isn't just about age. It's about the medications you might be relying on to manage anxiety, depression, or other conditions. And while these medications can be life-saving in many ways, they may be eroding your sexual health without you even realizing it. That's why it's so important to review your medications with your doctor regularly. Be open and honest about the changes you're experiencing, even if it's uncomfortable. Your doctor can help you adjust your treatment plan, whether that means tapering off a medication, switching to a different one, or adding another treatment to help restore your sexual health. It's never too late to reclaim your vitality. Take control of your health today. Regular checkups, honest conversations with your doctor, and staying informed are your best tools for preventing years of unnecessary frustration. If this video helped shed some light on the hidden dangers of common medications, make sure to subscribe and hit the like button. Don't forget to also hit the notification bell so you stay informed with more valuable health tips and keep your sexual health sharp for years to come. We're here to help you navigate these challenges with knowledge and care. Type PROTECT below if you're ready to take control. Your journey to lasting vitality starts today. I'm Dr. Catherine Rotker, fighting for your health, one truth at a time.